go.
Hello, everyone. Today, myself, Jocelyn, and Liz will be presenting on the CELF for Spanish, which the full name is the Clinical Evaluation of Language Fundamentals, the fourth edition, which is in Spanish. Okay, so for our KWL, what we know already, what we want to know, and what we have learned. So what we know already is that the CELF for Spanish assesses Spanish-speaking children only. We know that it is a standardized language assessment, and we already knew that it must be administered by a Spanish speaker, so Spanish SLP, or with a trained interpreter who is fluent in Spanish alongside the speech language pathologist. What we want to know are the different subtests and areas that are assessed within the whole test. We want to know what the purpose and need for administering the test is. We want to know the administration of the test, how it actually is administered. And then we wanted to know scoring, so what the different scores mean. And then lastly, what we have learned after doing this whole presentation, we learned how to follow the protocol. We learned how to interpret the results, and then we did learn what the results ultimately mean. And then we also learned that, as well as a speech language pathologist, that the CELF for Spanish can also be administered by Spanish-speaking school psychologists, special educators, and diagnosticians. Okay, so now to go into the differences and similarities that are between the CELF for Spanish and the CELF 5. So going over the similarities between the two tests, so they both measure language disorders and/or language delays in Spanish-speaking children that are ages 5 to 21. We know that both the assessments include a variety of different subtests that identify a language disorder. We know that it identifies language strengths and weaknesses. We know that it measures for receptive and expressive language, as well as language structure in the areas of morphology, which is how morphemes are used in language, and syntax, which is how words can be combined to form sentences in language, and semantics, which is the meaning of words and combination of words, pragmatics, which is the rules associated with language during conversation and things such as eye contact, and then lastly, in phonological awareness, which involves an individual's awareness of different sound structures.
Okay, so the CELF 4 in Spanish, the standardization sample represents the Hispanic population in the US. It's important to note that 39.7 identified as having a specific condition impacting educational performance. So more specifically, 2% were identified as learning disabled, 1% were identified with ADHD, and less than 1% were identified with developmental delays, hearing impairments, and other conditions. For the CELF for Spanish, the examiner must speak Spanish fluently and be trained in test administration. So for the CELF 5, the standardization sample is more diverse. So it includes bilingual individuals, it includes individuals who speak a different dialect other than standard American English. It includes gifted, talented, and those with diagnoses. To name a few, there's ADHD, learning disabilities, intellectual disabilities, Down syndrome, and CP. And for both of these, it's important to note that including children with disabilities can lower the mean scores and in turn will limit the test's ability to diagnose children with mild disabilities. And back to the CELF 5, this test is conducted in English.
As far as administration goes, as Shannon mentioned earlier, this test can be administered by an SLP, a school psychologist, or a special educator. The person giving the test must be fluent in Spanish, and if they're not, they can use a Spanish interpreter. The Spanish interpreter is not there just to convert from English to Spanish. The interpreter must be very familiar with test administration because if not, that could skew the student's performance and then their scores, and then the scores wouldn't be valid. So they must be very familiar with test administration. The two main rules for administration of the whole of the CELF for Spanish test: the administrator cannot repeat any sort of items on the subtest that evaluate auditory information. Again, that would skew the scores. And the administrator is allowed to repeat other items only once, but only if the child was not attentive. Because if you keep on repeating an item, you're pretty much at that point giving the answer away, which skews the scores and the child's performance. So with the CELF for Spanish, they have a lot of different subtests. So you have your basic subtest that are given for all different age ranges. So 5 to 8, 9 to 12, and 13 to 21 years old, even though each subtest will measure the same thing. So for example, like following directions and concepts, in which the examiner would to ask the student to perform an oral direction, like, okay, point to the blue car using visual stimuli. Even though it's covered in 5 to 8, 9 to 12, and 13 to 21 years old, it would increase in difficulty and hierarchy. So it's measuring the student's concept of understanding what's being asked of them, but it differs in each age range. In saying that, the CELF 4 is a standardized test, and every time they are tested on the subtest, the points are added up to get a raw score, and then the examiner would use the conversion chart to convert those scores into standardized scores. That way it's measured against their peers that are similar to them and see where they fall. Now, the core language score is combining 4 out of the 6 subtests. The 4 subtests that are chosen to combine their scores depends on the student's age range. And the core language score is the most representative measure of students' language skills overall instead of just individual subtests. It's 4 together. And if the core language score is an 86 or above, there is no need to further the testing unless there's evidence of a language disorder present. If they score below an 86, or if there is other evidence of a language disorder present, then you would follow through and not just do the basic subtests, but go more towards each index and use those subtests to target those index. So the receptive language index, expressive language and context index, language structure index, and memory. So that gives the examiner more information about the student and where their deficits lie to continue to do a treatment plan based on their scores and see where they lie against their peers.
Okay, so I'm just going to give some specific examples of the stimuli that are in the book. So for the concepts in following directions, they would present a picture like this, and they would ask the student to point to the red shoe or to point to the blue car. And for word structure, they would say, this is a boy, and this is a, and pause and wait for the client to say girl. Or they could say something like, this cat is sleeping, and this cat is, pause, the answer would be eating. So for formulated sentences, they would ask the client to create a sentence based on the picture that they present. So for this one, you could say the dogs are eating the trash, or the dogs are being bad. For word classes, they would present a picture like this and ask the client to differentiate between the categories. So they want to make sure that the client understands that the puppy and the dog go together and that the frog does not belong. And for sentence structure, they would ask a question like, point to something that you can wear. And so in this case, they would point to the shirt. Or they would say, point to the boy who lost his balloon. Or point to the girl who is reading. And for the last one, expressive vocabulary, they would simply just ask, "What is this?" And the child is to say, "It's a truck."
Okay, so now to get into some evidence-based support regarding the CELF or Spanish. So the article that I looked at on the left side is entitled Performance of Low-Income Dual Language Learners Attending English-Only Schools on the CELF or Spanish. So after conducting this research, they had found that there's no differences on the performance on the CELF or Spanish between Spanish monolingual and Spanish English bilingual children. So determining that separate norms for bilingual and monolingual children were not necessary, contradicted many researchers who had advocated for separate norms for dual language learners. So that was really important because they wanted to see if dual language learners were represented well within the CELF or Spanish. And after conducting the research, they find that they are. And then the research also found that standardized measures such as the CELF or Spanish and language sample analysis allow clinicians to assess several different areas in language skills like lexical knowledge, morphosyntactic structure, the child's semantic knowledge, and pragmatics, as well as their expressive and receptive language.
So the article that I found is titled Intervention for Oral Language Comprehension Skills in Preschoolers with Developmental Language Disorder. So in this study, there were preschoolers with developmental language disorder and without, so typically developing. And each group of preschoolers were examined and evaluated using several tests. One of the tests was the CELF for Spanish, and they specifically used the subtest concepts and following directions, word classes focusing on receptive and sentence structure, and 2 tasks within the CELF for Spanish that assess comprehension of paragraphs and narratives. And what these researchers did was create an intervention treatment plan to assist in the students' oral language comprehension skills. So they had the students get evaluated with the subtest pre-intervention and post-intervention. So what they found was all of the preschoolers with and without a developmental language disorder, their scores improved in the CELF for Spanish subtest after intervention. So it is implied that the Spanish subtest and the test in general measures what it is intended to measure, since it worked hand in hand with the intervention treatment, since their scores improved after treatment. Okay, so that's it for our presentation. If you have any questions, please don't hesitate to reach out to us. Thank you.